Welcome to Fitness and Thinking. This week we are talking on ideas of resilience, fitness, and how we learn to live maybe with a week of life that flips everything upside down. Ev, what have you taken from this episode? What did you enjoy chatting about?
Just get being asked a different frame and a different account of what was experienced. We didn't just do a surface level, we actually thought about how my experiences have shaped, and also looking at it from a different perspective. Like, I've never spoken about my love of being in the gym, and and how I'm responding to things, and it's been the first place for me to speak about quite difficult health scenarios and adding a bit more persona to what happened in Greg's.
Yeah, which is a wild story. And I think were it not for that, we wouldn't necessarily be having this conversation
No,
because
no, we
it,
wouldn't.
no, it really stood out when I read about it. But it refers to, was that in 2024 that it happened, but
Yeah,
2025 you spoke about it.
yeah.
Yeah. And maybe it's some signposts for people because we have spoken for a while and I want to make sure that people, as you described, get the value that you add. There are images that I think could be, quite graphic and maybe upsetting for people,
Yeah.
uh, pertaining to your experience in healthcare.
Yeah.
I think you touch on themes of resilience and how you've dealt with it, but just to flag that at the top of the episode.
Please, yeah.
Yeah. And then some terms that I think could be helpful going into what we discuss. So we have ME, also is more generally referred to as chronic fatigue. If you were to describe Mitrofanoff, Ev, how would you put that into a sentence?
A Mitrofanoff is a surgical procedure that creates a small channel from my bladder to an opening on my tummy, allowing me to empty my bladder using a catheter instead of passing urine normally.
Perfect. Of peripheral neuropathy.
It's damage to your nerves that are outside my brain and my spinal cord, based specifically on my left side. I think from my calf to my ankle, which has meant tingling, numbness, burning, and a bit of weakness. So for sometimes my balance on my left side isn't very good. Regular B12 injections have helped, but it still hasn't cured it. It's something that I live with and I manage. Usually when I've got UTI, a cold, or any other illness, it seems to flare it up. Or when I'm having the sacral nerve stimulator, it flares up as well.
Yeah. So obviously some huge experiences and terms
Yeah.
here. But I think if not because you know how to navigate all of these through personal experience, your background in marketing and your eloquence are huge throughout this conversation. So yeah, cheers for your time on this
Thank
one, Ev.
you. Thank you for having me, Jack.
I first became aware of you, Ev, around April 2025 when I read in the
Yeah.
Manchester Evening News that you basically had to show your catheter to a Greg's employee before they would let you use their toilet. Maybe as a way to frame this conversation, could you talk to us about how you got to that moment?
Of course. So I had been for a week by that point, had been having a catheter in me, so a draining tube for my urethra, because a week earlier I'd gone into urinary retention, that's later been diagnosed as Fowler syndrome, and I'm sure we'll come on to that. And I remember going into Greg's, because at the time I didn't know I could have a valve to release it, so I had a bag on, and it was getting heavy. So I was instructed if it ever got heavy to go to the find a toilet. And at the time, because I thought it would be a temporary period of my life, I never knew about the radar key or disability access to toilets, whatever. So I went into the Greg's near where I am, and I walked in and I said, "Oh, could I use that disabled toilet?" And the lady in front of the counter said, "Well, you're not disabled. You can't use it. We only allow it to be used for customers who are disabled." And I said, "But how do you not know that?" Because again, I'd lived with disability prior. I've got ME and peripheral neuropathy, so I'd always been known for talking about disability and the fact that for most of us who have a disability, it's often invisible, so you don't see it. And I said, but then I had to show her my catheter valve bag, and I said, "Does this now make me allowed to use your toilet?" And she said, "Yes." But it shouldn't have got to that stage. especially because I know that high street chains like Greg's and others are now being really hot on invisible disability and how that all disabilities don't always look visible. You aren't always going to find somebody who is typically stereotypically what you consider needing the disabled toilet. And I think it gave me a bit of it exposed me to the fact that if I experience that, what are women and men experiencing if they've got a stoma bag, if they've got anything else that requires extra need in the toilet. And don't get me wrong, I've been back in that Greg since, but it did leave a sour taste in my mouth, because it just, and at the time I didn't even complain about it. I'd actually, and you'll see, I was speaking to that journalist about, how catheter care is very, very complicated and how it's underfunded and like there's no support in place for anybody with a catheter, let alone a woman. And it came up, and at the when I just sort of like put it to the back of my mind. It was only when it gained traction in the press that I realised I should have probably spoken about this at the time when it was live and raw, but didn't think it to, because I was in such a state of, again, oh my God, my life has just changed within a week of need of never ever questioning the need to go to a toilet to suddenly being barred from using a toilet because I didn't look disabled.
A bit of a shift, isn't it?
Mm.
In terms of that week, how did that unfold?
So it's actually coming up to 2 years exact, the date when we're recording this, that I woke up, and I remember, because I went through my messages this time last year to like do a memory lane, and I'd seen that I'd text my mum and my dad separately because they are divorced now, and I said, "Oh, I've not been for a wee today," and they went, "Oh, have you drunk enough?" And I was like, "Well, yeah." I said, "I've drunk 2 of my Stanleys." I'm not sponsored by Stanley at all. I'm looking at it right now, and it was like, "All right," and didn't think anything of it. And that kept happening. Like every so often, I wouldn't be able to go to the toilet, and again, it would then come back a couple of days later, and I'd go, "Oh, you silly bladder, you work again." It was only when then it accompanied with regular UTIs that the GP was like, the urine's ability to not pee, she put down to maybe you've got a UTI. But I think the biggest thing that does make me reflect on it was that when I said to her I was unable to go for a wee, she said, "Can I do you a sample?" And I said, "But you'd have a hard job to get a sample from somebody who can't urinate." Yeah. So it kept happening in spouts. So it would be a couple of days. And then the day that it unfolded, I'd been out for breakfast with one of my best friends. She always remembers it. And we'd gone for a walk, and we were like having a heart to heart. And I'd felt fine all morning. And it was only when I went out that afternoon with my mum to a supermarket that I said, "Oh, I don't feel very well. Like my tummy feels really painful." I said, "I feel like I'm going to be sick. I feel a bit faint." I said, "I just don't feel very well." And she said, "Oh, go and speak to the pharmacist." She said, "But you look pregnant." And I was like, "I can assure you I'm not pregnant." I'd come out of a relationship, I think by that point, about 3 months later, definitely not pregnant. And I'd spoken to the pharmacist, and he said, "Oh, have you been able to go for a wee?" And I said, "No, I haven't." I said, "I've not weed for a couple of days now." And he was like, "Why are you here then? Why are you not in A&E?" And I said, "Oh, well, my GP said if it got worse to go back." And earlier in that week, I'd been to the GP, and she again had said, "Yeah, but if it happens again, go to A&E, or if it gets worse." And I use that line a lot now, because had I known the severity of urinary retention, I'd have gone when I was first in the retention stage. I wouldn't have left it so long before going. And they said, "You need to go to A&E right now." And when we eventually got to A&E, and I was waiting around, and I was pushed into different rooms, and it was an in and out jobby. And I remember texting my mum, and I said, "Oh, he'll be all right. I'll be sent home with some antibiotics." And I'd remember saying to the nurse who'd done all the first observations, I said, "Oh, would I be able to go home tonight?" I said, "Because I was due to be having a Chinese with my family tonight." And she said, "No, I'm really sorry." She said, we're not done with you. We need to know why you can't go for a wee." And she then got an ultrasound out, and I had about 900 mil in there that had just got stuck and could not come out. And I think by the time I'd left, the nurse brought in one of those big Pepsi Max bottles, and she said, "That's been your bladder over the last 24 hours. She said, "This has been going on for a lot longer than you realise, hasn't it?" And I said, "Yeah, I think it is." And it was at that point that things just never went the same. Like if I'm being honest with you, and I say this with a lot of conviction, that I genuinely thought I'd get the catheter taken back out, which was about 2 weeks later, and I'd go again, and I'd just say it was a blip of the past, and go, oh well, that you remember that time when I couldn't wee? Didn't think it would then go down into the length that it did go in.
Because you have been diagnosed with something that's rare.
Very rare, very. So it's Fowler syndrome, which means in women, and it's only a women's condition, that the urethral sphincter, which is what allows us to go for a pee and releases it from your bladder, decides to go into hypertension and it doesn't relax. There is still no science to know why it happens, how a woman can go from and have normal ability to go for a wee to suddenly being ridden with UTIs, bladder retention, bladder pain, bladder problems. And the understanding in the UK is still very poor. I would argue that in England and Scotland, we do have better care than other countries do, because there are women I speak to in Ireland and America and Australia. But the point is, it's a women's only condition that I was very grateful I got a diagnosis quite quickly in comparison to when I've spoken to other women, but it doesn't make that right.
No. And an issue with the diagnosis is that on paper, am I right in thinking you'd read like a 60-year-old man, basically?
Yeah, you'd the case notes, like if you presented the notes to your GP or even a urologist, they would look at it and go, well, you're 29, you can't wee, that's not a normal pairing. As we actually, for my age group, it's usually overactive bladder they see in women rather than the other way around.
Okay.
So it's weird that I never ever entered into that. It was funny because both my mum and my sister do have overactive bladders. So mine just went the complete opposite. But I think there's a lot of ageism within the catheter care and urology as a whole. I'm often told, well, we don't usually see women like you with a catheter. We don't usually see women like you on this department floor. And I think some people think that's a compliment, but at this point, I don't feel it's a compliment. I feel like it's quite passive aggressive. Because I always say, do you really think I'd want to be here if I had a choice? I don't think anybody would want to be here on this ward or department if they had a choice.
It feels from what I've seen in your writing and from other interviews that you basically weren't given the time of day because you didn't present as the typical user of a catheter. And I wonder, like, I don't want to put words in anyone's mouths, but I'm interested in psychiatry through my dad, who was a consultant psychiatrist. I'm interested in psychology, but I'm also interested in the history of both of these. Like, I want to be careful with what I say, but the notion of hysteria being a label that particularly male doctors, psychiatrists, psychologists would give to women, to describe symptoms that were going on elsewhere that they couldn't put down to anything other than the uterus. It's this thing of, we don't know what it is. So it's either because you're a woman or because something's not quite right in your head. So you've got the label of hysteria rather than necessarily a diagnosis that we might give to a man. Is that something that maybe you could relate to?
I'd be lying if I said I'd experienced that. I have always said that I've been very lucky that the experience I've had with urology around in my local area has been superior and it's been really positive. But I know of women who do not have that and they are labelled as manic, hysteric. They're making it up. They're making it a lot worse than it needs to be. I say that, and then when I think about it, when I was first experiencing these symptoms, I spent a long time saying to the doctors that would say, you're too young for this, blah, blah, blah. And I would say, but I'm not making it up, I promise you. And it was funny. It's been the very first health problem that I've ever had where I've never been told, you really should start thinking better. Because I know when I've had experiences with my peripheral neuropathy, I remember seeing a neurologist years ago who said to me, oh, have you tried positive thinking? Have you thought about it? Have you thought about it that if you're positive, you might not have it? And I actually challenged him on it. And I don't take any prisoners, as my friends say. I'm like a Jack Russell when I'm in a doctor's appointment. But I remember saying to that consultant, would you write that for publishing your latest research article about, and I actually went and looked at his studies, and I said, well, I'm presenting what you've written in PubMed, and you've not said positive thinking in there. I said, so if you're not prepared to put it in writing to get published, or writing it written in my notes, don't verbalize it. I said, because I am recording you and I will expose this, because I don't agree that you're saying to me to try positive thinking, because you wouldn't say that to somebody else. And I certainly didn't believe he'd say it to a man. Whereas urology has been very different. Urology have always been very understanding, but because of the experience I've had in previous medical settings, I think I've always gone, but you do believe me, don't you? Like, they don't think I'm making it up. And my parents would go, Ev, you can't make up urinary retention. I can't, but because of past experiences, I was very quick to go down, but they're going to think I'm making it up. Because when I lost sensation of my left leg, that's exactly what happened. I was told, you're making this up. This isn't real. We can't see anything on testing. Whereas for Fowler's and for retention in women, it's often visible on testing. It's not invisible. You have to be able to see it, because again, you're being full up with water and nothing's coming back out again, and it should do.
Yeah, for sure. So the notion that this clearly is a physical expression,
yeah,
and it also being rare. Following what you know now, what does 2026 look and feel like?
So I turned 30 recently. I really wanted to go into my 30s being fixed. So just before Christmas, I had my a surgery. So for the last 6 months, my family and I had been prepared for me to skip the traditional line of treatment for Fowler's. So while there's no cure, and I have to say that because everybody says it, whenever I say I've got an operation coming up, they're like, is this going to cure it? Is this a cure? And I'm like, no, it doesn't have a cure. These are treatments that make your quality of life better. I think, and that's what we have to distinguish when it comes to Fowler's, that whether you have a catheter surgery or you decide to intermittently catheterize, your life doesn't get cured. You can't then say my Fowler's is in remission, or I've never met anybody that can say that. But for me, I was under the illusion, as was my family, that I'd had my... So in the June, I was told the operation that we would like you to have probably won't work, which is a sacral nerve stimulator. And what it is it gets put in your back. And it's a little device that can stimulate the nerves for you to start going for a wee again. If you read up about it, it's a very successful surgery, and I know women that have had it, and it's been a game changer. Because of my previous medical history with peripheral neuropathy, my nerves are always very, very sensitive. And my testing means that my sphincter and my bladder have firmly shut the door. They don't want to release anymore. So they said, oh, it probably won't work. So we're going to have to consider the next step. But then when I saw my consultant in October, him and the department had said, but we want to try the stimulator, because if it works, it's going to be a game changer for you and it avoids major reconstructive surgery. I had it over the Christmas break, so you have to have it in for 4 weeks. Some women have it in for 2. You can't shower for 4 weeks, which in hindsight was one of the worst parts about it. Because I always joke to my friends that my bath times are like my self-care for when I can watch a film in the bath, but I couldn't do that. And it didn't work. It didn't make my bladder go. It actually just made my other side of my body numb, so they had to take it back out just before Christmas. And so 2026 is looking reconstructive, if you like. I'm having to have something called a Mitrofanoff, which is a urinary diversion where they create a catheterizable stoma, whether that through your tummy button or another hole right beside that tummy button. And I'm probably still processing it, because some people go, oh, but is it going to be a cure? And I'm like, no, it's just going to mean that my quality of life is better than what it is currently. Because I'm not going to be catheterized permanently. I'm not going to have a tube in me. I'm not going to be expected to have catheter changes every few weeks. For that side, it might be worth it, but it is going to be a slower recovery period than what I've just had done. So I think as soon as I'm just now at the mercy of a waiting list. I think, like other women and anyone else listening to this, that you get told you're having an operation, but it's not like going on a holiday. You don't get given your date and your timeline from your travel agent. You just sort of wait and hope for the best.
Mm.
So I'm waiting for that at the moment. I'm trying to prepare myself mentally and physically. I can now go back to the gym because obviously when I had the pacemaker in, I wasn't able to do so. And all in all, it's a big thing to come to terms with, and I think failing a trial was really hard to hear when they said that. When they took it out, they said, "Oh, well, you have to now put the vote you failed it." And I said, "Okay." And I think I'm probably still processing the fact that I failed something that didn't really think to me that it would fail at, really.
Is that a bit that's tough to take because of the sense of self in there that, you failed it, but it wasn't, as we know,
No.
it was a physical test in your body, that you are not responsible for as the entity,
Yeah. Yeah.
So I guess from a mental health bit, from an emotional standpoint, almost from a spiritual perspective, hearing something that's so physical put so bluntly, yeah, it can shake your core by the sounds of
Yeah.
it.
Yeah. And I think this condition is very multi-layered. I'm calling it like an onion. You have the first layer of your body goes through a huge change of being able to perform a normal bodily function to suddenly not being able to do that anymore, then having no control over anything else, because everything becomes up for debate. You then suddenly realize that there's so many systems failing the patient, especially like when I've experienced several incidences that I'm sure we'll come on to that have shaken me to my core. And I do genuinely think that my experience is when people say, "Oh, you're doing really well, you're coping really well," and I'm like, I've got to continue to live. I've still got bills to pay. I'm still having to work. I'm wanting to go and socialize, but there are challenges with this. My body has changed. I'm not the same as I was 3 years ago. I am now with a medical aid that, yes, it performs a life-saving function, but it's also an absolute pain in the butt because it's so complex. It's a very complicated relationship that I have with it.
Is that something that we pick up on? One experience, maybe, I think you're referring to, involves an iPhone torch. Is that right?
Well, I've actually had a new one.
Oh, no.
The first incident with the iPhone torch, in hindsight, was a breeze. That I think for me, that the worst part of that was how exposing it was. To be told after a test that's already very invasive and not very pleasant. It was a urodynamics assessment. So if anyone listening has a catheter or any urology problems, they'll know it's where they put tubes up your back passage and your front passage, and they fill you with water and they try and determine, does your bladder and do your systems contract when fluid is entering into your system. For me, there was no sign, but it did show like, my bladder fills up normally, but it says no. It does a Gemma Collins and goes, no, not happening, not going anywhere. And it's not the nicest. But when he used his iPhone torch to then try and find my urethra after what was only considered a really invasive and horrible procedure, was just not nice at all. And it was only when I was telling people weeks later, they were like, "Why didn't you complain?" I'm like, "I can't be bothered." Like I just can't be bothered because he's never going to admit to that. I've got no witnesses. I'm just going to have to own it and hope that my downstairs department doesn't find itself on an app somewhere. But I have spoken since to his colleagues whenever I've had them in, when I've had A&E visits, and I'm going, if he's on call, I'll stay home and I'll come back tomorrow. But most recently, I had an incident where I'd gone to my A&E, and over the last year, I've had several catheters get stuck. So they've not wanted to come out from where they should do. And I had one just before Christmas, and the nurse that I have, who came out to my home because again, I fought long and hard to have access to catheter community care. I think I spent 3 months complaining, and I think it took me writing to my local MP, writing a story, working with journalists to expose it. Did it get dealt with, and I got addressed. Um, and I've got a lovely nurse. I think she's amazing. She came out and she usually doesn't have any problems with it. It slides out for her. I always say my bladder's good, well behaved for you. And it was not budging. And she said, I'm really sorry, I'm going to have to send you to A&E. And I said, no worries. I said, it was good while it lasted because everyone else struggles. And I got to A&E and I saw the doctor who I have seen before in like a urology clinic. So I said, oh, hello, you all right? And I'd expressed to the nurse when I arrived, I was in a lot of pain. I was in about 10 out of 10. And I've built up quite a high pain threshold through this journey. And I think you do because you're either somebody who can tolerate it or you can't. And I think for me, the first few things I had done were just uncomfortable. Otherwise, it's becoming tolerant, but that doesn't mean it's acceptable. And he came in and I said, before you do anything, could you give me some pain relief? I said, because I'm in a lot of pain. And he said, oh, could you just get up onto the bed for me? And I said, yeah, that's fine. And before I could say no, he's trying to yank something out of my private parts. If you Google a suprapubic catheter, they're usually placed in your abdomen. Mine is further down because of how small I am. And so I always have to get changed. And I'd say, can you get off me, please? And I had to slap him away and get the nurse and the junior doctor he was with to physically get his hands off of me to get off me before he would get off. And it was probably the most distressing experience I've had done, to be honest. And I remember laying there completely in tears. I actually audio recorded it because I always have done since the iPhone incident. I've always worn my Apple Watch to appointments like that because I'm so scared of what might happen. So I just record it. And he got taken off of me. And one of his juniors said she was in pain. I think she needs pain relief. Yes. So they went and got it. And within 5 minutes of administering it, he said, can I have another go? And I said, no, you're not. His junior couldn't get it out. And she said, do you think we should maybe book her in for a general anaesthetic or a sedation because it might be better for her to be in less distress? No, we're too busy for that. And he then said to the nurse who'd actually asked for him to come down to see me, we're so busy downstairs, this is really not what I should be doing. And I heard that. And then he said to me, oh, could you apply it? Can I put some numbing jelly around it? And I said, you're not, but I know how to do this because I've lived with them for so long. I know what you're going to do and where to put it. I said, until somebody else is in here, you're not doing it. I said, because I don't trust you. I said, you violated my body once in the last half an hour. You're not having another go. And then he tried to say, oh, you're doing it wrong. You're doing it wrong. And I said, no, I'm not. I said, I know where my hole is and I know how to and where to apply it. I said, because this is my only form of pain relief sometimes. And he was vile to me. And in the end, it took him the reason it was hurting so much was he didn't deflate the balloon. So a catheter, for anyone that doesn't know, is the silicone tube that's in you is held in place by a balloon that's filled up with water. And for him, what he hadn't done was deflate the balloon properly. Right. So he was pulling a inflated balloon that's usually only about 5 mil from a very, very, very small hole. And so it was very painful. And he said, this shouldn't be so painful, blah, blah, blah. And I said, but it is painful. That's the argument I've got. And he was pulling and pulling and pulling. Before he was allowed to, his junior then said, look, we need to find a way of dealing with this because this can't go on. He went downstairs and got a camera that they put up your urethra for testing. And through that test, or through that examination they did, I could see my poor urethra scarred and bled. It had bled and it was in incredibly a lot of distress. But it explained why for the last 18 months I've been in so much pain from that. And I actually was caused from Mr. iPhone Torch. Everyone's got nicknames, and he he was then had to use a needle to try and burst the balloon from up the other end, and his other doctor was at the other top end with me, poking it down from the other end. And I was told afterwards that I should have been asleep. I shouldn't have been wide awake in an A&E bay.
Mm.
And it was only when I left that I was in so much distress. I woke up in the middle of the night in a hot sweat. I was in pain for 2 weeks afterwards. My urethra bled for 2 weeks. When I had my surgery done just before Christmas, the hospital that I'm at said, look, we can't take this out of you because we need to do it under a general anaesthetic. So can we tell your surgeon to take it out while you're under? And I said, please, I'm not having you touch it while I'm awake. And there was 600 mil trapped in there that they'd not been able to get rid of. And it explained why I'd been so much pain, so much bloating, and why I felt so poorly in the build up to that. And I just think to myself, it could have been avoided. And that's what his superior has said. And he is penned it. I can't discuss any more than that, but I'm aware he is, pending an investigation and there is work being done. But whatever I think about it, my experience should never have happened. And I've spoken openly on it about with my TikTok channel or on my blog, because it's an experience that should never have happened. But I think the biggest challenge for me was the lack of consent at the first point, but also just the complete ignorance around pain thresholds. Pain is subjective. And I remember being told that by a nurse. She said, look, whatever I think, she said, your pain is your pain. I'm not in your body. As nurses, we are trained to believe the patient and you are your expert. So if you say you're in pain, you are in pain. There isn't a what if, there is no, but she shouldn't be. There is no word as should. And it was a very distressing event, and one that I would not wish on anyone.
I'm really sorry that you've gone through that. Yeah, it sounds just from start to finish, as you say, completely avoidable. And I think when you describe your story at the start of, well, you don't look disabled, well, you shouldn't be in this amount of pain, there seems to be this recurrent theme of people telling other people how things ought to be or should be. And obviously, as your nurse described, as your nurse pointed out, our experiences are unique to us. How do you think then, based on what you've described just in this conversation, things could be different? What can be changed?
So I've been thinking about this long and hard, actually, in the build up to our convo, and I think it's like a twofold thing. First, we need to understand catheter care as a subject, because this is bigger than Fowler's. This is actually catheters more generally. I've spoken to various women whose partners have got prostate cancer, so end up needing a catheter or need to see urology. And the biggest challenge that comes up is that you get given a catheter, you get fitted, and then you get left for 2 weeks, if you're lucky. So if you know that in 2 weeks you'll be given what's called a trial without catheter, which is where you're asked to fill your bladder up and you are then taught how to self-catheterize. For some people, that is easy. Men more than likely get on better with it because they can see their pee hole. Women can't. Women have to do a very intimate manhandling of their female parts to find their urethra. And I've met no woman, unless they're a nurse, who can say they know where their urethra is without needing a mirror. And again, it was too painful for me. And I know women with Fowler's struggle with self-catheterizing anyway. But my point being, in 2 weeks between that and the first catheter being fitted, I was given no support, no guidance. There wasn't, you would expect this and this to happen. It's normal to have blood in the bag. It's normal if you do have a UTI, it's normal for this, nothing. Then after every test I had done, I had to then have another catheter refitted. But after Mr. iPhone Torch's experiment on my downstairs department, I was left to it. And it was only when I had to be admitted because it had expelled did I get a new catheter. And even then, wasn't given a plan of when they should be changed, how many times, the fact that you are not qualifying for catheter care unless you're over 65. In between that, you're expected to go to A&E after every single problem. And for me and other people, you're spending a lot of time in A&E that does not need to be done. I think I've done a research on this because I wanted to be able to challenge it and prove a point to to my people around me to say, look, I am costing the NHS more every admission because they're not allowing me to have access to my community nursing. So if you're given a catheter, whether you're male or female, you're not given the support after you get that fitted. You know, the GP, I've gone on to GP appointments and the GP has never seen a catheter before. They don't know that actually most processes for a UTI do not apply when you have a catheter. And then if you look on the other side of it, we also have all of the other challenges that go with it, that you're given a one, but you're left to it.
Mm. And then it's on top of UTI risk, you've got an increased sepsis risk as well. Is that right?
Yeah. I had sepsis in my first year. I think by that point I'd been 4 or 5 months into having a catheter, and it was horrific, absolutely horrific, because I remember being in so much pain in my urethra, but again was putting it down to Mr. iPhone Torch's lab experiment. And we'd rung the doctor and we'd rung the nurses, and they'd said, you need to go to A&E, like, because it might be blocked, because I've woken up and nothing had gone in my urine bag. I don't do that anymore, thankfully. I don't need to bag it up, but nothing had come out, and usually stuff comes out overnight, and it hadn't, so we knew it was blocked. And I waited, I think, all day before someone said, no, we're going to admit you, we need to put you on IV. And I only learned recently, and never went on my record. So whenever I've Googled it, when I've gone onto my NHS app, I can't actually see that I've been admitted for sepsis. And even my admission itself has never really been documented. Even though I was on a ward for 2 days, I was on regular IV antibiotics, and I was given a lot of pain relief afterwards, there was no real substantial paper evidence of what had happened. But yet I know thousands of women, well, not personally, but when I read their stories and watch their stories, it's very similar. You get told you've had sepsis, but you don't get given no evidence. So if you say that to a health professional, they're like, well, then isn't it in your medical record? And I know that from family members who've been in hospital recently, when they look on their notes, the full exact admission details have not been listed. And I don't know why this is. It's maybe because we don't want memory of it. I don't know. I'm not too invested in this to be able to give you an exact reason. But I do think that sepsis is a huge risk that people don't get. For me, I know that catheter-associated UTIs are very common. Everyone I know with a catheter has had an infection. It's really hard to avoid them. But your bladder becomes a bacterial magnet. You know, it sits in there for a long time. Your bladder is a mucky pup. You know, it gets bacteria in there. So trying to avoid it is, you can't. It's impossible to avoid an infection, sadly. And I think we aren't told that actually, if you were to test my urine, I would have an infection, but I might not have an infection, if you know what I mean. It's always going to be a bit of a double positive. So women and men get put on loads of antibiotics, get resistant to them. And actually, when you break down, you think, was it an infection? So now my urologist has very much always said, we go based on symptoms. We don't go on smelly urine, because it could be, if you've got a backache, fever, tummy ache, bloating, all of the other urinary tract infection symptoms, great. But if they're not accompanying, we don't want to give you antibiotics for no reason.
No, because once you're resistant, that's it. Fitness and Thinking is a podcast and newsletter centered on 6 pillars of fitness: the physical, mental, social, spiritual, emotional, and financial aspects of being. We have no sponsors at the moment. I'm not looking for a penny, cent, or peso from you, just for your support. If you like what we're up to, please do leave a 5-star review where you can. Please do leave a comment saying what you like, saying what you change, saying what it is that you do differently, and 100% share it with your friends, family, partners, workmates, whoever needs to hear the ideas that we're going to explore through this year and have already explored. Share it with them. something that you and I are both interested in is being physically fit in the gym. And I know before your diagnosis, that was a part of your life and you had PT.
Yep.
And I understand now that you can go back into the gym that obviously it's going to be a part of your life. What does fitness look like to you now?
When this all kicked off, I'd lost weight, hadn't actively gone out looking to lose weight, but I wanted to get back into fitness after so I had a relapse in 2020 with my neuropathy. So I couldn't feel my leg on my left side. So walking was really difficult. Exercise was also really difficult because, again, I didn't have the coordination or the strength to be able to do it. And I think the year of 2023, like the beginning of it, I'd started working with a PT, and the goal was to try and gently step back into things I had done previously with the enjoyment, but with the added extra of weight training. And over time, it got easier, and like a byproduct was losing weight, but I didn't actively go out looking for it. And then when my bladder went into failure and my body changed, the process has been very different. The symptoms started, and I think between January and April, I was really consistent, showed up to PT, went to all of my classes. Now, however, it has been a very up and down process. Some months I'm in the gym week to week, even if I do have a UTI. Other times, and for me, it's not even necessarily the UTIs that prevent me from going, it's usually urethral pain. If my urethra is painful from usually an infection, ironically, or post catheter change, or just in general living with something that's a chronic illness, means I can't go. I used to do spin classes regularly. I used to love aqua aerobics. Aqua aerobics has completely flipped it because every time I go into the water, I was noticing that my urethra would sting if the chlorine touched it, so I couldn't do it, and I was walking around just unable to do it. So I had to get out of the class, and eventually it was just becoming embarrassing having to keep getting back, like getting myself psyched up to go, to then have to come away because I couldn't do it. I love Bollywood dancing. I do that regularly, but again, it was all about, some weeks I could show up and do it, other weeks were not possible, and the same went for a PT. And I think for me, my PT has also had to learn about Fowlers and catheters, and also just down below, because I think for most of us as women and men, to be honest, you don't ever hear I've got pain in my urethra. Like, it is quite a niche thing. So people go, but is it okay to like lift heavy? And I'm like, sometimes it's fine, other days it's no, not happening. And that's not to be over dramatic, that is the nature of this health condition, that it fluctuates all the time. It's stability, it's getting myself prepared for major surgery. That's been my goal the last few, like when the pacemaker failed and it wasn't working, and I knew that the major surgery was the next step, I consciously made a decision to put that in the back of my mind and try and do what I can. So for me, that is, going for a walk. For me, I can walk. That's something I can do regardless. Going to my classes is something that I'd love to be able to do, but I also have to try and find some self-compassion and go, look, it ain't happening today. That's okay. We're allowed to take that rest day. But it's a very different relationship you have with fitness once your body says no. It's different when you're mentally saying, can't be asked. But when there's a pain point preventing you from going, it can be really challenging to then not want to go back out.
How do you handle moments like that? Have you figured it out yet? Is there guidance you could give?
It's a long process, and I'd be lying if I said to you I've got it all handled, and I just go, that's just what it is, that it doesn't matter, but it does. When I have those days when I can't go to the gym, or I can't go to that class or go for that walk, I'll always come back to what else can I do that shows that I'm showing up for myself. So that might be hitting a protein goal, drinking fluid, because for me, again, something with a catheter is worth knowing, your hydration has to be on your game. So for me, if that's something I can control, how much fluid I take. So if, yes, I might not be hitting the gym, but I am flushing my bladder with lots of fluid, and doing all of the stuff. So it's about finding the win somewhere else in my day. And that's how my PT and I sat down and went, actually, if you can't make that class, what did you do that made that day on plan, on goal? Drinking 2 litres, more than 2 litres, making sure that you make a conscious decision with, okay, I'm going to cook a really good meal that's high in protein, got all the good volume foods, but also not punishing myself because it's a day and we live on a floating rock.
Yep. I mean, you're preaching to the choir here. It's amazing to hear
I
it.
think for me, my current, not fixation, because I think that's quite a toxic way of wording it and a scary thing, but the whole BMI debate is something that does what every time I present myself to a doctor's appointment, or when I have your pre-op, everyone's like, oh, we got to take your weight. And it's the worst thing. I hate being weighed with a passion. I remember going in for my very first smear test, and the nurse said to me, on your BMI, Evan, you are considered overweight. And I was like, well, I did just lift 55 kg in the gym, but I'm overweight. And again, it's still that the NHS and health systems still do use that metric to gain if you're overweight or underweight, rather than looking at the bigger picture of she might be in the gym a lot more lifting weights. She might be having a lot more inflammation. There might be a bit more water retention than, say, Sally down the road. And that's for me the biggest frustration about it, that I'd hate to be looked at as overweight or obese just on a BMI, even though I'm able to weight train, go for walks, and live relatively healthy despite a body that's not physically healthy, if you like.
100%. I think BMI is an imperfect measure. And if it doesn't factor in the holistic person, as you say, increased water retention, medical conditions, diagnoses that we know are in effect and have an impact on a person's presentation, but also life generally, then obviously it's not a helpful metric. I think for the general person, though, a lot of PTs will be overweight on BMI as maybe an orthogonal point to yours rather than to butt heads. I think if people are coming up as obese on BMI, then there may be an amount of fat that could be lost, for instance. But that range from healthy to overweight could be due to water retention, could be due to extra muscle mass. And I think, yeah, you need to look at the person before you say that alarm bells are ringing there. When we step over into kind of the obese range, typically statistically, we are an overweight nation, and America is an overweight nation. And this is an issue, and this is a societal thing that I think people don't recognize the importance of moving, whether that is just walking in a day, whether that is eating fibrous foods and not relying so much on processed things, and also just lifting weights, how that can improve a person's quality of life. You don't just go to a gym once and find yourself in the overweight category because you can lift an amount of weight, for instance. No. So I think there are still things that we can do. BMI can be a measure, but certainly it's not one that you should base your identity on. I just think also as a caveat that we don't ignore this sort of stuff, because there are things that all of us could do, PTs included, that would lead to better quality of life. So when we talk about general population and things like BMI, I think some people can feel frustrated by this. Maybe they look at the scales and they feel that they're not seeing progress. And maybe something that you and I have an experience of from different levels is the notion that what you weigh isn't who you are. It's a part of, sure, where you're up to in a given moment. But I try not to describe the programs that I might write for people as weight loss programs. Usually it's about fat loss if they need to lose fat, or it might even be weight gain. And when I'm talking about gaining weight, I'm often talking about putting muscle on, unless a person is, very thin and actually medically underweight. That would be a different conversation to have.
Yeah, completely.
When we think about maybe society that you've also found, though, Ev, and we're thinking about people who are active with catheters, who will maybe have a similar experience to you of managing pain, but then also not being limited by what doctors have said that they shouldn't do or can do. Again, it's this thing of shoulds. What's been your experience of maybe getting to know people who are in the fitness space, and maybe your own experience of what your body can do?
I remember when I was diagnosed with ME, and it's sometimes known as chronic fatigue syndrome. It's a very complex illness, and one that would take up an entire episode to discuss some of the challenges that patients experience, and also how we we approach the subject entirely. But the work that I've done around it and also spoken about my experience, I remember being told by the neurologist that diagnosed me, the normal process here is that you should, again, the word should, go back and do your exercise classes and building it up. And it was called graded exercise therapy. And it actually got disproven as a successful treatment for ME CFS because it was not right for the illness. In actual fact, it made a lot more patients worse. I found that my recovery, and I say recovery very lucid because it's a condition that you live with and it fluctuates. So I notice the difference if I've been back to back really busy, or when I've been recovering from illness. I noticed that when I had a general anaesthetic, it took me a good couple of days to get rid of the fogginess. Again, I don't know if it's ME related or whether that was just having my first general. I'm not sure. But I remember when I was doing a class and at the end of it, they said, has anyone got any questions? And I remember going up to the instructor and I said, I've got to be completely honest. I said, I can't do what you wanted me to do because I can't feel my left side. My balance on that side is really poor. But you never asked if anyone had any medical conditions or anything with problems. You just corrected my form. I said, had you known about that context at the beginning of the class, you would have been able to give me a better class effect. And again, going into a class environment is very different to working with a PT who you get to know. They know your body, you know yours. They know what normal looks like for you. Whereas in a class environment, you are one of 10. You blend in very, very quickly. But that, again, it was interesting because after that, he deliberately asked every time. And I noticed that his colleagues also started. So I think I ruffled some feathers by pointing it out. And I know as a fitness person, you must be sick to the back teeth of every class. Does anyone have any injuries I don't know about? I'm even doing it now. But it's part of the health and safety side of things, as I know. And again, like you are told you should be able to do this by now. And it's like, no recovery. And it's the same with living with a catheter is linear. You have periods of where you can do it and you're thinking, wow, I'm like Davina McCall. And then other times it just falls off and you're back to square one again. For me, when I'm able to do all of the classes and I'm living my best life as I describe, and I'm hitting the gym, going to PT, and I feel great, wonderful. But when one of those is dipping, I do notice that I spiral and I can often get led down a path of you're not good enough because you've not been able to go to the gym today, like the normal bugbears that most of us all experience here and there.
Yeah, which all of that is completely fair and understandable, and I think all class leaders should be asking that question. So again, I think the ways that you've described advocating for yourself when you go into an appointment and saying that this is my experience, this is what I've noticed. Similarly, if you go into a class and you expect that, or you suspect that what you're feeling could impact how the class goes, it's helpful to know. It's helpful for the instructor, it's helpful for you. And in so doing, maybe you generate a better experience. And I think the instructor nearly always will feel better for knowing that maybe they've done something that's helpful, or has contributed positively to somebody's day. So if you allow for an opportunity to improve, then that's usually taken positively.
I remember when, sometimes you feel really uncomfortable when you have to ask or you have to tell someone that. And yeah, it's not nice. It can be uncomfortable, but I do think in the long term, it's better for you and it's better for your peers around you that people need to know when it's right to call it out. And that's how I felt, that had they asked that question at the very, very start, they would have known that no, I couldn't have done that class properly, or I would have needed extra support or advice. And it's just you're not having a go, you're not being irritating, or you're not being that person. You're just trying to point out a fact that deserves to be told, not only for you but for a future person that's going into the gym for the very first time, needing a bit of support from it. That unfortunately you're doing yourself a favor, but the person that's coming in after you in the next class a favor too.
For sure. The number of times that I haven't been able to give an answer or know necessarily what the adaptation was and gone off to research so that the next class I was actually kitted up with what I needed.
Yeah.
resulted in people asking if I would PT them. You know, it went from a class thing to, I really appreciate that effort that you made. Could we work one to one? So, you know, I'm speaking professionally as somebody who's going to be teaching classes again. If you have big groups of people, get to know everybody and ask the questions and don't be afraid to not know. Go do the research once you know what you're looking for. And from there, nurture the conversation, nurture the relationship, and
Yeah,
see
and
what happens.
also acknowledge and leverage the fact, and this is me being a marketer and a PR person, but seeing it as a learning opportunity that actually, you know, you might gain more PT clients, you might gain more attendees at a class, but then you're giving those patients a voice and somebody to turn to if you're recognizing that everybody that walks into that room is going to have a different experience to your class. One person might find it the best thing since sliced bread, and another person might look at it and go, oh, I didn't like that. I'm not coming back to that.
Yeah.
And it's okay to recognize that, I think.
I'm wondering, based on everything that we've gone through, with the knowledge, experience, maybe the opportunities you've had to help other people, what do you wish existed that doesn't yet?
For somebody who's first entering into, you know, they've got symptoms of anything, whether that be ME, peripheral neuropathy, or even Fowler's, and, you know, they're experiencing bladder symptoms and they're not quite sure. The biggest piece of advice I give is keeping a record of it. And I know that sounds very boring, but by keeping a record of it, whether that be in writing as a diary for you to look at, you know, what's happened, what needs to happen, what are the problems, what have you tried, what hasn't worked, and also keeping your health professionals to account is really important, and getting the confidence to be able to advocate for yourself. I would love there to be support out there for advocacy. I think patient advocacy is still bubbling away. I know some charities that do amazing work within the advocacy space, but actually day to day, that work doesn't seep through in other areas of healthcare for patients. I would love there to be much stronger resources when you're entering into appointments, when you're navigating it, you know, as somebody who entered into urology, which is predominantly male, old, white and stale males. It can be really challenging and actually quite intimidating. And had those resources been in place, I might have felt a bit more comfortable. But again, there are things that just don't exist for a reason yet. And maybe like I'm pushing for there to be better advocacy places within our health systems to make sure that in every appointment, patients don't go home with more medical trauma than they went in with. You know, I do think that's something that needs to be addressed. I think medical gaslighting, medical trauma, doctors having this God complex can be really damaging to patients. And I do feel for patients who come away with that experience. I myself have had it, and I'm forever grateful that my bladder problem was never consulted with neurology, because I think I'd have had a very, very different experience. All of my experiences with neurology hadn't been positive. It had all been but no test is confirming that. You must be making it up. Or have you tried this? Have you tried positive thinking? Have you tried peppermint tea? And it was really basic, quite patronizing ways. Whereas urology, I've had, this is unbelievably difficult for a woman of your age to be dealt with. Blah, blah, blah. There is a huge difference. And I wonder if there is a lesson to be had from each other's department, clinical backgrounds, that each specialty does their job in a very different way.
Quality of life, and you know, fitness is one way to improve it, but then also what you're waiting on at the moment.
I'm meeting with the surgeon in a couple of weeks, and you know, these are the options we've been told to prepare for, as options will be given. I'm looking more towards a Mitrofanoff because of, you know, my clinical picture and what I know. And there is going to be time spent in hospital. There is going to be time spent recovering and then learning how to navigate life with it. And I think from start to finish, it can be between 3 to 6 months. And so I am probably mentally preparing myself for being completely useless for a couple of weeks. And waiting for surgery is never easy, whatever one you're waiting for. You are going into the unknown a bit. You don't know what you're going to get. You're thinking, is it going to be smooth sailing? Am I going to be that one person that gets that complication? There's so many things that come up whenever as I'm preparing for it. Yeah, like it's going to be a long burner, I think. I think for at least 6 weeks, life probably won't look any different. But after that, I will learn how to self-catheterize through my tummy button, hopefully, and life will get going again. Because I do still feel that my life is a bit on pause. It was my 30th over the weekend, and a family member said, "What do you want for your birthday, Ev?" And I said, "A holiday.
Yeah.
I just would like to lay on a sun lounger and ask if the buffet's open again." People go, but you can still go away with the catheter. It's not your life hasn't just shut up shop. No, but whenever you have a complication, chances are it's always when you're out of the country or you're near somewhere that doesn't have the right resources in place. There are so many obstacles that when you get put with the catheter, you realise are not there. And all the
How,
complications that come with it.
yeah, how do you deal with that if you're away from home or from where, like your community nurse? How would you deal with this?
I had an incident a few months ago where I was getting my car serviced and the catheter valve fell off, so all my urine went all over my clothes. And it's fine. Like if it's ever happened locally and I'm with someone that can drive me back, it's fine because I can sort of hide it and no one know. But when it's happened as it did then, it was probably the most embarrassing and just awkward experience of my life. Thankfully, I had family members that lived quite close by where my car was being serviced. It could change, but it didn't take away from the fact that it happened.
Mm.
It was a really difficult experience to be put through, and people looking at you and people not knowing. I know people look because it's a sense of curiosity, but it don't take away from the fact that it happened, and it was quite scary to experience that, of what the hell's happened. I'm now walking around wet, my clothes are ruined, I'm in my own urine. Like it's just not a very nice experience for anybody.
Oh, and I think the way that you describe kind of being on pause, or in your writing, you describe life becoming a bit smaller than you were used to.
Very insular.
Yeah.
Yeah.
But this year feels like it could be different with the Mitrofanoff, and
Yeah.
yeah.
Yeah, I'm confident that while it's something that is long term, it's reconstructive, so that like the recovery window is going to be longer and meatier. The long term vision that I've seen through other patients I know that have had it done. I've joined lots of support groups. I've tried to understand what the recovery looks like for most people. And a lot of people I speak to, they say, look, in the first 6 weeks, you're going to question why you've done it.
Mm.
And then in a year's time, you'll be saying you'd redo it over again to be free of all of the complications that came with the last 2.5 years. Like, I think what's saddest is when it all started, I was told you'll be done by the end of the year. And I only got my first surgery at the end of last year, and that didn't even work.
Yeah.
It's just the guidance.
Having that guidance feels like it could be massive. And I wonder, in terms of what I've seen of you online, it feels like you're providing the guidance that you almost wish you had.
Yeah, a lot of people say that.
Where can people go for that guidance? How do you help people? Where can they see more from you?
I talk about my experience on my blog, but it's too wordy for you to remember, I think. So I combine it for you, for listeners. I document it on TikTok. My TikTok handle is at shortstuffcoms, where I present not only my business, but also my experience with Fowler's catheter care, and just unpack my experiences, because I do think you need that space to have those conversations properly, and yeah, make sure that you can communicate them and people feel that there is someone on there. Because I remember vividly being in the hospital that very first night when the first catheter was fitted, and my algorithm chucked up a video of a woman who woke up one day and couldn't wee again, and it was the weirdest thing in the world, but
Mm.
it was the nicest thing because I realized that someone else has been here, done that. And I think that's really important, that while social media has its cons and we moan about it a lot, our press love to dismantle it and love to ruin it. Yes, there are some bad things about it, and there is this sense of competition on social media, I see. But for the majority of it, it can be life changing. It can be so rewarding to have a community on there, to know people who are in your boat, who can say, no, don't do that. No, actually, have you considered this? Have you thought about asking your surgeon about this option? Have you tried this? Like, I remember there was a heat blanket that somebody recommended. It was the best thing I've ever bought. There are things that my medical NHS team would not know about, but on TikTok, you know about it. You pick up. I've picked up on so many little gems through social media. Yes, there have been some trolls and awful people, but for the majority of it, people are always trying to be helpful and look into things and guide you for it. And that's something that's got to be said.
Yeah, because I think there is a big difference between a medical diagnosis, medical care, and kind of community grouping and community care. And it does feel like you're a leader of that, but somebody also who's benefited from it.
Yeah, I also want to be aware that I'm a little bit further ahead in the journey, and it was very lonely when I first started. And people deserve to know what happened during those times that I might not have opened up about. Like, I look back on the content I was sharing in the first few weeks of my diagnosis, and I was a bit lost. I didn't really know what to post. It was only in the last year or so that I've got a bit of clarity and gone, actually, what's more helpful is if someone put a video up saying what to expect with this procedure, rather than talking about what outfit I wore to the event. Again, I think from a marketing perspective, and I think I'm doing a bit of added extra here about how are you adding value to your community? Are you posting selfish content, or are you actually trying to say, look, you can reshare this to somebody down the line? Most recently I've done a series about how to complain, because I think we're all able to put complaints in. We're all able to advocate for ourselves, and that's great. It's a great place to be. But we have got to be prepared that how can I say this? I think we need people that can share their experience and saying, this is what happened to me, and forward that content on, because I wish I'd had that, and I'd like to give people the honest truth, not to say it's the most painful thing in the world, because that might not be your experience. And I think that's really important when anybody is sharing content with complaining. Everyone is a complainer at heart, everyone can do it, but it's about doing it in a way that's impactful and it gets the outcome that you want. And I think that we forgot. We've done it when we had to do our GCSE English language exams, but we sort of forgot how to do an argument as adults. We forget that you have to take some of that experience from school days and drop it in, because being clear to the point is much better than saying we were stuck in traffic and we were behind these roadworks that took forever, like it didn't work out, blah, 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 blah. It doesn't help in the long term. So I'm hoping that I add some form of value for TikTok.
I think from what I've seen of you in writing, on video, on short stuff comms, the amount of value that you're adding to the conversations that you're in is huge. And
thank you.
I really appreciate you taking time to walk us through your experience, this afternoon, now evening. Because as you say, you're potentially further along than some people listening to this.
Yeah.
But I think the number of people who can kind of take strength and maybe inspiration from the resilience that you've shown and had to build, and it's huge. So thank you for your time. Hey up, cheers for making it to the end of this episode. If you enjoyed that one, I think you might like this one. And why not subscribe if you haven't already, so you never miss an episode again.